whenever I go home, I want to go home knowing that my day was fulfilled with satisfaction in what I did. The connection that I developed with my patients, the connection that I developed with my parents really speaks volumes. And the fact that they come back multiple times during their development kind of speaks for itself. My inspiration to become a doctor came from when I was a child. I remember my grandparents always telling me, we need a doctor in the family, and that led me into a path of science. My path into ENT, into ear, nose, and throat, actually came as an accident. While I was in college, I was working on skin cancer cells, and I decided to look for a physician who was doing some sort of work that I could continue my research interest. Well, it turned out that that physician was working in collaboration with ear, nose, and throat in laryngeal cancer. And the passion for ENT kind of grew. During my years of training, I started noticing that my connection was better with the kids than with the adults, and decided to do a fellowship in Pediatric Otolaryngology. I handle both medical and surgical conditions of the ear, nose, and throat in children that are just born to 18, 20-year-old young adults. I can see a kid that might have some simple fluid in the ear that might be affecting their speech development. I can see a newly born kid that might have failed their newborn hearing screening, to a child that might be having some issues snoring and having difficulty breathing at night, or an adolescent that now, suffer an injury after a softball game and is having breathing issues. I've seen kids when they were just in the NICU or the neonatal intensive care, and I have taken care of whatever airway issue they might have at that point. And, they continue to grow. They have issues with their ears, their recurrent ear infections that might need some drainage of fluid or something simple. And they continue to grow until they're adolescents now, and they might have other issues that kind of come together with age. And it actually gives you satisfaction to see that what you did when they were an infant now has an implication as they're continuing to grow. I feel like I need to really have that click and that initial click with the child so that they can trust me. Once the child is able to trust me, I can transfer that connection to the parents so that whenever I explain, hey, they need this medical manager and they need this surgical management, that bond is already there for them to trust in what I'm saying.